Okay, let's have a look at this article by Tony Hope. He's arguing in Good Medical Practice or Murder, Euthanasia. He's arguing that it's morally required that euthanasia is morally required, which is a little beyond what most of us would have thought. Again, I said before, many people, if they're in favor of euthanasia, not everybody is, it's an option, it should be something that should be allowed. Arguing that it's morally required, which seems to be arguing that it's morally required for both the physician and the patient, is a little bit extreme from what we've been used to hearing. So let's have a quick look at what Hope's trying to say, and perhaps a little bit of clarity about that. So he's relying on the difference between active euthanasia and passive euthanasia. He calls active euthanasia mercy killing every once in a while, so those are being used interchangeable. And passive euthanasia seems to be withholding life-prolonging treatment, what we called foregoing treatment earlier. The argument here is that the justification for passive euthanasia, which is coming up in a moment, would also justify mercy killing. Examples of passive euthanasia he gives: a patient with an incurable and fatal disease who will die in a day or two, or with very poor quality of life. Dr. Cox's example is an example of mercy killing, and then the trapped lorry driver is the other example. What's his case for passive euthanasia? Well, he argues that in the case of the patients who are going to die soon, maybe have poor quality of life, he argues that it's in their best interest to die. And interest is like, what is their best outcome? And he argues that the patient wishes to die. So he says in these situations, everybody would agree that passive euthanasia is justified, maybe even required on the part of the physician who's hearing the request. And so he argues that mercy killing, if it met those same conditions, would, by the same argument, be justified. Okay, so arguments, if it works in one situation, it should work in another situation. There's a slight objection to this, a small objection, which comes up at the end, which I won't treat here, that killing is wrong in principle. As we said before, that it's intrinsically wrong to kill somebody. If that's true, then mercy killing would be ruled out because of that, but there's no killing going on, and again, in what he calls passive euthanasia. So let's think a little bit about what he's doing here. He's imagining that a patient is thinking morally about their care and asking themselves which outcome is the best outcome, which is another way of saying what's in my interest, what's in my best interest. So the patient says, well, I could not be treated and die now, or I could be treated, but that treatment will be pointless, maybe even prolong my pain. So the patient comes to the conclusion that dying now is more in my interest than dying later. So there would be a very basic understanding of what does it mean to be in somebody's best interests. Okay, now here's a point where I want to say this is not exactly the way we were thinking about it before. And I don't know if this is the best way to think about it, but there's at least one other way to think about what's going on in the patient's mind. We argued that end-of-life decisions are not decisions about death. Who's sitting around thinking about when do I want to die? Do I want to die now or later? I don't think anybody wants to die, okay? But they're decisions about treatment. What kind of treatments do I have? What's the nature of those treatments? And in particular, is any of those treatments ordinary or extraordinary? You remember that distinction. So ordinary treatment is reasonable treatment, treatment that is right to choose, wrong not to choose. Extraordinary treatment is treatment that's optional treatment. It does some good, but there's some aspects of it that aren't good, and so it's our option to choose it. Okay, so we still said treatment, all treatment is good. It provides a good end. It's a tool, and the question is the tool going to help or not? Now, if you think about it that way, extraordinary treatment is treatment that there's no obligation, moral obligation to choose. or to give to the patient. Okay, so we can think of it from the point of view of the patient or from the point of view of the physician. So refusing the treatment or withholding the treatment, withdrawing the treatment is all morally permissible. It's not wrong to do that. Now, I think at this setting, we can imagine Tony Hope, that's what he looks like, sitting over our shoulder telling us, okay, so that's exactly what I'm telling you. So then you are choosing death and admitting it's in your best interest. It's exactly what I, Tony Hope, said. Okay, now I hope you're thinking maybe not, okay? And I don't think necessarily that's the only way to understand what's going on in this patient's mind. So I imagine the patient saying, not at all. My interests are not to be treated with optional treatment. My interests aren't to die, it's just not to be treated with that treatment. That means that I will die. I put probably, because who knows for sure whether you'll die, much sooner than if I was treated, but it isn't necessary that I am choosing to die. I am choosing not to be treated and accepting my death, my very soon death, as the necessary consequence of that. And that happens to us all the time. Lots of times we are, by the nature of our standards, our moral ethics, we have to do things that, well, ethically, this is what I want, or I don't have to do that. And then we have to accept the consequences. To say, well, you're choosing the consequences, that's a play on words. I mean, if we take those words seriously, I could say sensibly, I'm not choosing that, but yes, I'm accepting that that's going to happen, and I'm seeing that that's the necessary consequence. So, but in mercy killing, you can't conceivably explain it that way. In the case of mercy killing, I say there is no way that I can say that killing myself isn't my choice, because I'm actively killing myself. So you have to go through all the motions, all the choices. I am agreeing to have it done. So we're back to the question, is the nature of mercy killing? What is the nature of mercy killing? If killing is intrinsically wrong, then I am committing a moral wrong by choosing mercy killing. I am committing a moral wrong that I am not necessarily committing in passive euthanasia. So I want to come back to this question of the nature of killing in the next video. But for now, let's just now conclude with what seems to be coming out of this is that there's two kinds of passive euthanasia. At least Tony Hope is not accepting this. There is passive euthanasia where someone refuses life-sustaining treatment with the intention of killing themselves. That could happen. Or where someone refuses life-sustaining treatment with the intention of foregoing optional and unwanted treatment with the understanding, I use the word acceptance, that it means my death. Well, that's at least a very different way of thinking about it. So Tony Hope's way of thinking about it isn't necessarily the only way we have to think about what's going on in these situations. And if I'm right that there's two ways of doing this, it depends on how you're going to use the word passive euthanasia. If you're going to make the argument that mercy killing would be justified by the same reasons that passive euthanasia would be.